when the sun is high in the afternoon sky.
Hi, I'm Sandra Gordon.
I'm Elsa Luis.
I'm Dr. Ian Tucker.
I'm Deb Bellevue.
I'm an X-ray technologist.
I'm housekeeping. I'm a sister of St. Joseph.
Director of Food and Nutrition Services.
I work in the clinical engineering department.
I got into medicine so that I could make a difference in people's lives.
I come here helping people. It's no strain on me, it's automatic.
I fell in love with being able to help people that really needed my help.
When I was 6 years old, my mother told me I was going to be a nurse.
I think it's just the way I was brought up to care for people.
To care for our patients.
I love to help patients.
I love being able to take care of patients.
I always want people to feel good.
It's so gratifying for me. It really does. It makes me feel good.
In general, makes me feel like I'm doing something that's relevant and meaningful.
It makes me feel better about myself.
It gives you kind of a good feeling that you can actually go in and make their stay a little bit easier.
I do believe I'm fulfilling my call.
One piece that's, I think, the same for all of us is compassionate care.
Compassion to me means putting yourself in the shoes of the patient.
Looking at the other person and really feeling what they are feeling.
Caring from the heart.
Treating them like a human being.
We can transform patients' lives by standing witness to their pain and by healing their pain.
It makes it a little easier to be sick and to get better when somebody truly cares about you.
You can't heal the body without fixing the soul.
It's not just about providing the care, but it's how it's provided.
The end goal is to provide this compassion, this level of care to every patient, and every person has a part to play.
Our mission is to be a transforming, healing presence in our communities, and that's truly what we live by every day.
We feel we're an integral part of the community, and the community is an integral part of us.
We're Catholic with a small c, which means we're universal.
It's not whether or not they have insurance or whether or not they can pay the bill. It's how bad their need is and whether or not we can meet it.
And we are special affinity for those who are poor and vulnerable.
If we have healthier communities, whether it's mental health or medical health, people go on and lead very functional, happy lives, have children, have jobs, participate in community activities, volunteer. These are all the things you need for a good community.
Our providers really come here because they do have a calling to provide better care to our community.
It's more than just work, it's a passion. It's about believing that we're here to serve a greater purpose than just a job.
Love the people I work with. I don't mind getting up at 6 o'clock on the days I work.
I love the family-oriented organization that I work for.
It's like a second family for me.
It's like a family. We're family.
You walk in and it's a family atmosphere.
Patient walks in that door and you instantly become part of our family.
The friendly and collegial environment here is second to none.
Folks here never fail to rise up to a challenge, to overcome the challenge, and do it working hand in hand, arm in arm.
We help each other.
Everybody has an extra set of hands for everybody.
The best thing about all of my colleagues is the caring and compassion that they put forth in their job.
We work as a team with the patient being at the center.
We're here all for the same reason, to take care of the patient.
Patient comes in, patient has a certain illness. There's a certain expectation medically. And when you add a level of commitment that I think the team here does for each patient that comes in, there's a human factor that there's really no way to quantify it.
We're all different in some really wonderful ways, but we're all the same too.
Which is why we're here.
Why we're together. We didn't come together because we're near each other on the map,
But because we're near each other in our hearts.
And in our minds.
Because we all share the same heritage.
The same values.
the same mission.
To care with great compassion.
To treat each individual with dignity and respect.
And to make our communities healthier and more vibrant.
We are St. Francis Hospital and Medical Center.
We are St. Mary's Hospital.
We are Mercy Medical Center and the Sisters of Providence Health System.
We are Mount Sinai Rehabilitation Hospital.
We are Johnson Memorial Medical Center.
13,000 colleagues.
Providing a full spectrum of healthcare services.
We are Trinity Health New England.
We are Trinity Health New England.
We are Trinity Health New England.
We're together for a reason.
Estamos juntos por una razón.
We're together for a reason.